Hello YouTube, this video is for those who's looking for an idea on how to do this assessment or taking classes at Capella University. This is assessment 2 for the class NHS-FPX5004, and I took this class as part of my master's curriculum in nurse informatics, and I hope you'll find it helpful. This is a title page. As you can see, this paper is about leadership and collaboration. Please add your professor's name on here. June 11, 2024, Lynette, Lakeland Medical Clinic. Hello, Lynette. Thank you for providing me with the opportunity to serve the organization in a responsible manner by solving the problems related to diversity in the workplace of the Lakeland Medical Clinic. This is an exciting chance to perform as a leader, and most importantly, I thank you for entrusting me with this leadership position. Based on the information that you have provided me with, I think the best way to overcome this challenge is to evaluate the collaborative and transformational leadership strategy. Leader selection and comparison to my own skills. The qualities of a leader for this initiative should include collaborative. The leader should be able to assemble individuals from diverse backgrounds and cultures and appreciate what each of them has to offer. Kiwanuka et al. 2021. Visionary. The leader should have a clear goal and objective for diversity and also encourage others to have the same goal. Empowering. It is also necessary that a leader fosters and supports employees so that they become personally responsible for the firm and diversity of its capabilities. Kiwanuka et al. 2021. Excellent communicator. The leader should have good language skills to argue why diversity should be practiced, counter arguments, and encourage the members to participate in the progress. Cultural competence. He or she should be aware of other cultures and other people's values and traditions so that he or she can adapt to and interact effectively in a multicultural environment. Open-mindedness. The leader must be receptive to change in as much as they need to embrace diversity within the organization structure and facilitate the implementation of change. Kiwanuka et al. 2021. Problem solving. It is the responsibility of the leader to solve problems and demonstrate problem-solving skills to ensure they get the best strategies to overcome any issues arising out of diversity. Leadership model. Taking into account the mentioned qualities and competencies which are required for the project leader, it is possible to state that the most appropriate model concerning the given situation is the transformational leadership model. Since silencing followers and pressing for results directly contradict goals, transformational leadership with an emphasis on change and activation of followers is opposite to straight coercive leadership. The main features of transformational leadership are as follows. Idealized influence. The main function in which leaders engage into is to cultivate a relationship with the team and to become unique figures of reference. Inspirational motivation. The leader discusses with members of the organization and prospects of actualizing the organizational vision. Collins et al. 2020. Inspirational consideration. Here the leader demonstrates politeness about disparity of abilities and probably the demands on each team. It also aligns with the vision that I described for this initiative by requiring collaboration, empowering the stakeholders, and cultural sensitivity. Leadership transformational theory can be of great help to guarantee that more members within the committee are up for participation in the progress. The person who would be ideal to lead this initiative is Dr. Alice Stanford, a pediatric cardiologist and the founder of the Black Doctors COVID-19 Consortium in Philadelphia. Over the years, Dr. Stanford has attained a profound reputation as a talented and persistent physician and a real fighter who can unite people in open-reach discussion to change the healthcare system for the better. With respect to competencies for this role, it is evident that Dr. Stanford's leadership approaches and values underpinning this initiative involve engaging and empowering populations often marginalized from healthcare, making her the ideal candidate for this position. Newman and Ford 2021. Having focused on the factors that contribute to health inequalities and how to open up equal opportunities for accessing quality care among minority groups, she is regarded as an influential authority in the medical profession. Another leadership strength that Dr. Stanford possesses is that she can mobilize people from different cultures to achieve a given goal. For instance, she has an endless ability to grasp the diverse views that different people may have, defining what unites most or all of them, and this she may turn into a mission and goal. Kiwanuka et al. 2021. This skill is going to be very valuable for navigating the interdisciplinary committee that will be tasked with handling the diversity concerns at the Lakeland Medical Clinic. I am very outgoing and passionate about the welfare of other people, closely related, extremely supportive, patient, and courteous to everyone. I'm also fluent in the art of conveying messages, namely strategic communication, where one must fit the mode of communication in the requirements of the targeted group. Newman and Ford 2021. In my opinion, I may be somewhat inexperienced in terms of community engagement and may not have the strong established roots that Dr. Stanford has in her practice. As I reflect on the identified strengths of Dr. Stanford and evaluate them against my leadership competencies, I consider myself a likely beneficiary of a range of qualities that make her successful. In order to cover for this possible deficiency, I will make an intentional effort to seek and include the voice of the Lakeland community in consideration. Newman and Ford 2021. I shall also apply my administrative skills and ability to pay close attention to aspects of the committee's work grounded on evidence-based practices in relation to the multicultural population group. Key issues and proposed strategies to address them. The following are major diversity issues in the workplace in the context of the Lakeland Medical Clinic that must be addressed by the committee. First, they do not diverse staff in the clinic, which is why their recruitment and staffing policy needs to be reviewed. The committee should concentrate on the factors hindering the attraction and retention of a workforce with a perceived at least a higher level of diversity compared to the existing one, including healthcare providers and support staff. Wilbur et al. 2020. Potential solutions for it could include pursuing further unconscious bias training, diversifying the outreach to include underrepresented instructions and organizations, and offering the support headlined by underrepresentation in the form of mentorship programs and the like. Moreover, the recommended committee is required to consider the obstacles to practicing culturally sensitive care in the clinic. This is achieved by evaluating the strengths and challenges regarding the instituting's approach to cultural competency, language barriers in communication, and diversity in care-seeking systems. Kiwanuka et al. 2021. In an effort to increase cultural competence, the committee should suggest and implement staff cultural sensitivity training for all employees, language translation and interpretation services to help lessen communication barriers among varied patient populations, and community engagement boards to help direct the clinic on ways to meet the needs of all patients. Lastly, the committee should concentrate on aspects relating to the clinic's inpatient population and efforts towards eradicating disparities in healthcare. This means that the committee can produce a report that clearly shows the trends of patient outcomes according to the specific demographical characteristics, thereby determining any existing inequalities. Javan-Parast et al. 2020. Possible measures to address this issue can include working on quality improvement projects, using patient navigators to coordinate gaps in the healthcare system, decision-making based on their strengths and talents. There will be a frequent and open communication policy, primarily to improve the flow of information as a means of executing various tasks assigned. Javan-Parast et al. 2020. This will mean face-to-face meetings, but also the activities of online group discussion forums and video conferencing that will allow committee members to discuss and share ideas as they engage in the committee's activities, even when they are physically apart. To ensure that the process of working in committees is effective and efficient, I will clearly define job descriptions of each committee member, as well as set common goals and timelines. Wilbur et al. 2020. I will also adopt some procedures like using round-robin discussions, having follow-up activities like checking for understanding and active listening, and much more to ensure everyone is involved and the process is on course. Furthermore, it is notable that I will use present-day contributing academic and professional material sources to help guide decision-making, Newman and Ford 2021. This may involve secondary research in analyzing information about existing diverse and effective healthcare organizations, primary research by identifying and studying culturally competent practices in organization and community relations, and possibly outside consultation with expert sources in the field of healthcare equality. I believe that the committee will be able to systematically understand the problems and suggested solutions for the Lakeland Medical Clinic's diversity issues if more emphasis is put on the transformational leadership style, collaboration, and the use of evidence-based practices. In the future, the analysis and strategies discussed can be used to address diversity concerns in similar institutions. Those through constant adjustments of the described leadership qualities as well as the specific measures and strategies for their application, one can guarantee the inclusion of various groups of employees in the organization and environment of a given enterprise. This is a reference page. Thank you for watching, and I hope you now have an idea about how this assessment should look like for you. Got a couple typos. All right, thank you all, and Boris Karaman, bye.